Hello everyone. So as we have started the gynecological case series, today we will discuss case 25 which is on postcoital bleeding. So let me first tell you what is postcoital bleeding. It refers to spotting or bleeding that usually occurs after intercourse, but it is not related to menstruation. So we will discuss it in detail through a case so it will be easy for everyone to understand that what is postcoital bleeding. So a patient is a woman who is 18 years old, came to gynecological department with the complaint of postcoital bleeding. In recent 6 weeks, this was her approximately 7th episode. It has been seen as a red blood in small amount which is noticed a few hours after intercourse, and this bleeding was lasting up to 2 days. And patient also says that she is not having any pain associated with the intercourse. Now we will discuss about the menstrual history. So her menstrual history says that last menstruation was 3 weeks ago, and her menstrual cycle is generally of 4 days, which repeats every 28 days. Previously, the periods were so heavy, but now they are lighter in comparison due to consumption of combined oral contraceptive pills. And patient started taking these pills 6 months ago. So patient is taking oral contraceptive pills to lighter her periods. There is no history of abnormal discharge or odor, and she has no dyspareunia. So she says that she is not having painful intercourse. Her sexual history says that this patient has three sexual partners previously, and now she is only with one current partner for 10 months. In her history, she has never been diagnosed with any sexually transmitted infections or also never had a smear test. Medical history: she had an appendectomy, which is the surgical operation to remove appendix, at the age of 7 years, and also was diagnosed with epilepsy in her childhood time, but she had stopped her medication from 8 years. So now we will discuss about the objective data. On examination, we found that the abdomen is soft and non-tender. Speculum examination reveals a florid reddened area symmetrically surrounding the external cervical os with contact bleeding. The cervical os is the opening in the cervix at each end of endocervical canal. And the uterus was in normal size, anteverted and non-tender, which remarks that the uterus was absolutely normal. And there is no cervical excitation and the attachments are unremarkable. STI screening, which means sexually transmitted infection screening, is performed in investigation, which includes following methods: endocervical swab for chlamydia, endocervical swab for gonorrhea, high vaginal swab for trichomonas. Here, chlamydia, gonorrhea, and trichomonas are the examples of sexually transmitted infections, but candida, which is not a sexually transmitted infection, but it can be a possible cause of irregular bleeding from vaginal inflammation. Endocervical swab is the procedure in vaginal examination where the physician uses a swab to take samples of mucus and cells from the endocervix. A cervical smear should also be taken to exclude cervical intraepithelial neoplasia or malignancy prior to treatment. Here, cervical intraepithelial neoplasia, also called as cervical dysplasia. Basically, this is the development of abnormal cells in narrow neck of a woman's uterus It's most often caused by HPV, which means human papillomavirus, and may lead to cancer if it is not treated well. So, assessment says that in a young woman, postcoital bleeding is a common symptom and it is normally benign. But in this specific case, the investigation are consistent only with three major options like cervical ectropion, malignancy, or infection. On further investigation, the final diagnosis says that the postcoital bleeding was confirmed on cervical ectropion. So now we will discuss about postcoital bleeding. It is, as we have discussed earlier, that it is a bleeding that occurs after the sexual intercourse, but it is not a menstruation, and it is having multiple etiologies such as cervicitis, which means inflammation of cervix, or cervical polyps. However, the most serious cause of postcoital bleeding is cervical cancer. Now we will discuss about differential diagnosis of postcoital bleeding in a young woman. Cervical ectropion. It is a benign condition that is regarded as a normal variant found in a woman of the reproductive age groups. Second one is chlamydia or other sexually transmitted infection. Example is syphilis, gonorrhea, etc. Third one is cervical malignancy. In this cancer, the growth of cells starts in the cervix, and human papilloma virus plays vital role in causing most cervical cancers. Next is complication of the combined oral contraceptive pills. It includes spotting, thromboembolic diseases, hypertension, increased vaginal discharge. This can be seen as a complication of using the COCP. And the last one is endocervical polyp. They usually occur in premenopausal women and they typically arise from cervical glands in the endocervix. Let me repeat the causes of postcoital bleeding once again. First one is cervical ectropion. Second one is chlamydia or other sexually transmitted infection. Third one is cervical malignancy. Fourth one is complications of using the combined oral contraceptive pills. And the last one is endocervical polyp. Now we will discuss in detail about cervical ectropion. So it is the main cause of postcoital bleeding in this patient. It is a benign condition which is found in the women of reproductive age groups, and the occurrence of cervical ectropion is related to increased estrogen levels, means it is usually seen in patients who are having elevated level of estrogen, and these estrogen levels are high in adolescence, pregnancy, women on hormonal contraception, during years of menstruation, most commonly seen in ovulatory phase. So in these all conditions, cervical ectropion can be seen. Now we will discuss about the treatment. So cautery is an outpatient procedure carried out without general or local anesthesia. So what is cautery? It is the technique that burn the flesh or body and remove undesired growth of cells where bleeding is occurred. Nowadays, we uses two types of cautery techniques. First one is electrocautery and second one is cryotherapy, which means freezing. So we will see the management of postcoital bleeding. If we assume that the swabs and smear tests performed were resulted as negative, then the diagnosis is of cervical ectropion, and it is common in the time of puberty and the woman using oral contraceptive pills and the woman who are pregnant. So treatment are having different options and it is given as per underlying cause. So if the patient is having sexually transmitted infection, so we need to treat that infection. And if the patient is taking oral contraceptive pills which causes bleeding, so we have to advise to stop that pills and otherwise use the alternate contraception. And in if the patient is having cervical ectoprion, then surgical procedures are done like cold coagulation of the cervix and diathermy ablation of the ectocervix. In diathermy, it is a medical and surgical technique involving the production of heat in a part of a body by high frequency electric currents to stimulate circulation or to relieve pain or to destroy unhealthy tissues. So this was all about the cervical ectropion and postcoital bleeding. I hope you all understand that. Thank you for watching. Please share this video and subscribe the channel